Good evening, I'm Michael Fair, and welcome to your KHOU Channel 11 News. Another inmate in the Harris County Jail just died last night, and he had a history of mental health. Today, we wanted to bring to your attention about mental health in the jail. Due to the lack of treatment, many people with mental health are dying in the system, and Texas is no different. A Houston landing investigation found that nearly 180 people in Texas who were flagged as potentially mentally ill died in jail instead of receiving the necessary care. People with mental illness deserve help, not handcuffs, yet people with mental illness are overrepresented in our nation's jails and prisons. About 2 in 5 people who are incarcerated have a history of mental health. This is twice the prevalence of mental illness within the overall adult population. Given these rates, Americans' jails and prisons have become actual mental health providers at great cost to the well-being of people with mental health conditions. Did you know most prisons lack the funds to offer adequate mental health treatment? Those who offer the services of some kind may be limited in the types of treatment they provide. The jails are also overburdened with inmates. There is not enough room in the mental health units to help inmates get the proper treatment or stay under the care of a doctor, and is left in general population, which can be detrimental to them. Now I'm going to turn this over to Matthew McDonald.
Thank you, Michael. I'm Matt McDonald. We're in one of our local correctional facilities here in Orange County. Now that we know why there's a lack of mental health resources in correctional facilities, let's examine the effects of incarceration on mental health and why that lack of resources is so important. Some estimates as much as 50% of your state and federal prisoners have some form of mental health illness. When we put that into perspective, there's almost 10 times more mental health patients inside facilities like these than there is inside of actual mental health facilities across the nation. Currently, there's going to be 2 perspectives that basically talk about how incarceration affects mental health. There will be the importation approach and the deprivation approach. The importation approach suggests that individuals want to bring that trauma they have from their outside lives and bring it inside the correctional facility. These pre-prison adversities can include things like homelessness, literacy rates, childhood trauma. So they're going to bring those experiences in with them, and that's already going to contribute to their poor mental health. In contrast, we have the deprivation approach. This is where the mental illness is caused basically by this environment that we're inside right now in this facility. As you can tell, there's a large echo in here. So it's going to help contribute to other factors. So basically, your inmates, when they come in here, they're going to have sensory deprivation, isolation, violence. Also, the prison environment induces strain that's going to cause anger and frustration. If we view this as a general strain theory, inside the prison, there's going to be a failure to achieve positive goals, removal of any positive value stimuli, the presence of negative stimulus is going to be everywhere. This is going to also increase the chances of developing mental health disorders and worsening pre-existing effects. So when we look at it, this place is barren. There's no stimulus in here. There's no sound. You're in here by yourself all day. So the studies are showing when you're inside conditions like these, what it does is it affects yourself neurologically. So when you're inside this type of environment, you have lifelong stimulus, basically any type of sensitivity to sound has been caused by altered brain waves. Also, your animal studies are going to show where you're placed in prison conditions. It's going to reduce the volume of your cerebral cortex, diminish the rate your neurons fire, and affect your amygdala. And after isolation, the animals in these studies, they never return to normal. So it's going to be very similar to the conditions that we're facing here. Up next, we have Johnathan that's going to review the rights inmates have regarding mental health in a correctional institution. To you, Johnathan.
Thank you, Matthew. Inmates too have rights regarding mental health issues. Some rights that they have are rights to adequate medical and mental health care, the right to protection from harm, including from staff, the right to informed consent, meaning that staff should discuss with the inmate the nature, purpose, risk, and benefits of types of mental health treatments they will be receiving, the right to refuse treatment, including psychotropic medications, just like every other normal person. They have the right to the least restrictive environment and the least intrusive response to an apparent need for mental health services. They have a right to be confined in a place that can provide the treatment needed. They have a right to confidentiality in the delivery of mental health services and in mental health and related facility records. They have a right to regular and timely access to medical and mental health staff who are culturally competent and qualified to provide adequate treatment and supervision. Inmates also have the right to be transferred to an appropriate medical or mental health facility or unit when conditions warrant. They have a right to be free from corporal punishment, chemical restraints, and sexual abuse. Inmates have the right to an individualized written treatment plan, which can be updated on a periodic review based on the prisoner's needs. And that is all I have regarding mental health rights that inmates have while being incarcerated. Up next, we will have Rodrick Lewis speaking on treatment options offered in correctional facilities. Rodrick, take it away.
Thank you, Johnathan. Rodrick Lewis reporting from the Caddo Correctional Center. Thank you for explaining the rights inmates have regarding mental health. Now let's look into some of the treatment options offered in correctional facilities. Mental health treatment in correctional facilities are designed to address a range of psychological issues that inmates might face, often caused by the stress of incarceration. Here's some of the common mental health treatment options. Psychiatric services. Access to psychiatrists who can diagnose, manage, and treat mental health disorders through medication and monitoring. Individual therapy. One-on-one sessions with a psychologist, psychiatrist, or trained mental health professional to address personal issues, trauma, and develop coping strategies. Group therapy. Group sessions provide a platform for inmates to share experiences and learn from others under the guidance of a therapist. Crisis intervention. Immediate response services to address acute mental health crisis, which can include suicidal ideation, severe anxiety, or psychotic episodes. Psychoeducational system programs. These programs educate inmates about mental health conditions, coping mechanisms, medication management, and life skills necessary for managing stress and mental health systems. Some other classes that they offer is behavioral therapy, trauma-informed care, re-entry care programs. The effectiveness and availability of these treatments can vary depending on the facility's resources, the staff's expertise, and the policies governing the correctional system.